introduction to liquid dosage forms. This is a disclaimer for the viewers. Moving towards the liquid dosage forms. So liquid dosage forms, these are liquid preparation in which active medicament is dissolved, suspended or incorporated into suitable vehicle intended for internal, parenteral or the external use. That is known as the liquid dosage form. So these are the liquid formulations in which the active medicament is either dissolved, suspended or incorporated into suitable vehicle which is intended for internal, parenteral or the external use. Liquid dosage forms are further classified as monophasic liquid dosage forms and biphasic liquid dosage forms. Monophasic liquid dosage forms are further classified as for internal use and the external use. Internal use like solutions, elixirs, linctus, drops, syrups, draughts and mixtures. For external, for the skin, the preparations like solution, lotions, liniments. For body cavities, the preparation like gargles, throat paints, mouthwash, eye drops, ear drops, nasal drops, and the sprays. Let us see the advantages of the liquid dosage form. Liquid dosage forms are easy to swallow, easy to apply on affected area. There is a faster absorption as compared to solid dosage form. These are palatable and this is the best choice for the pediatric and the geriatric population. Disadvantages of liquid dosage form. They are easily contaminated with the microorganisms. Then low dose accuracy. It is bulkier than the solid dosage form. Then it is having a low stability than the other dosage forms like a solid and semi-solids. It is very difficult to formulate bitter, nauseating and poorly soluble drugs into the liquid dosage form and need special storage condition for the liquid formulation. Moving towards the solutions. So solutions are liquid dosage form in which one or more drug dissolved in one or more solvent to form a clear, homogeneous and a single phase system that is known as the solutions. So solution, it is a single phase system in which the drug it is dissolved in a suitable vehicle. It may be used internally as well as the externally. For example, iodine solution, it is used externally and ondansetron solution, it is used internally. That is ondansetron oral solution IP. The advantages of solutions, it gives fast onset of action, then easy to swallow and flexibility in the dose adjustment. And the disadvantages are shorter shelf life. The drugs which are having an unpleasant taste, it is not possible to formulate it into the solution formulation. Then inconvenient to handle the solutions. It requires careful measuring. Then it requires special storage condition and there may be the chances of microbial contamination. So this is about the solutions. Then the mixtures. Mixtures, it is an extemporaneous liquid preparation meant for oral administration in which medicaments or the medicaments are dissolved or suspended in a suitable vehicle that is known as the mixture. It is supplied as a multiple doses in one container and can be used within a short period. That is known as the mixture. For example, kaolin mixture, BP. So this is a kaolin mixture, BP. Then the draught, it is a liquid oral preparation that is solution or suspension administered as a single dose. For example, laxative draught or the albendazole suspension. Marketed preparation of the draught, that is a albendazole oral solution, Nawar, and vitamin D3 oral solution. So the draught, it is a liquid oral preparation administered as a single dose that is known as the draught. Moving towards the syrups. Syrups are concentrated aqueous preparations of a sucrose or a sugar substitute like methylcellulose with or without flavoring agent and the medicinal substances. That is known as the syrups. Syrups can be classified to the medicated and flavored syrup. USP syrup contains approximately 85% weight by volume of sucrose and IP simple syrup contains 66.7% weight by weight of sucrose. Let us see the advantages of syrups. Syrups are economical and safe to patient. It's easy to administer. It masks the bitter taste of drug. It contains little or no alcohol and it gives soothing effect. So these are the some advantages of syrups. Moving towards the disadvantages of syrup, there is a delay in the onset of action. It is not suitable in emergency and unconscious patient. It can't avoid the first pass metabolism. For example, cup syrup, brisol syrup, and iron-rich syrup. So these are some marketed preparations of the syrups. Elixirs. Elixirs are clear, sweetened, hydroalcoholic liquid intended for oral use. It contains approximately 5 to 40% of ethyl alcohol. They are usually flavored to increase the palatability. So elixirs are clearly sweetened hydroalcoholic liquids intended for oral use. Non-medicated elixirs are used as a vehicle, and the medicated elixirs, which contains antibiotics, antihistaminics, or sedatives, which are used for its therapeutic effect. Moving towards the advantages of elixirs. Elixirs, these are less viscous than the syrups, then easy to manufacture, better able to maintain both water soluble and alcohol soluble components in solution, and it is a stable preparation. Disadvantages of elixirs are it is less effective than the syrups in masking taste of the medicated substances. It contains alcohol which accentuates saline taste of the bromide. So these are some disadvantages of elixirs. For example, salbutamol elixir, digoxin elixir, and the paracetamol elixir. Here, these are some marketed preparations of the elixirs. Let us see the linctuses. So linctuses are viscous monophasic liquid preparation containing a high concentration of syrup intended to sift and swallow slowly without dilution for treatment of cup, that is known as the linctuses. So linctuses are viscous monophasic liquid preparation containing a high concentration of syrup intended to sift and swallow slowly without dilution for treatment of cup. It contains high proportion of syrup and the glycerol. Further, it contains medicaments which shows demulcent, sedative, and the expectorant action. For example, simple linctus and the codeine linctus. Let us see the drops. So the drops are liquid preparation for oral use that are intended to be administered in small volumes with the aid of suitable measuring device. They may be solution, suspension, or the emulsion. For example, paracetamol oral drops. So here, these are some marketed preparations of the oral drops. Gargles. Gargles are aqueous solution used in a prevention or treatment of the throat infection. They are prepared in a concentrated form and to be diluted with warm water before use. For example, betadine gargle. So gargles are the aqueous solution which are used in a prevention and treatment of the throat infection. And before use, it should be diluted with the warm water. Mouthwash. Mouthwash, these are the aqueous solutions with a pleasant taste and odor used to make a clean and deodorize the buccal cavity. It is similar to gargles but used to treat oral infections and maintain oral hygiene. For example, thymol mouthwash, chlorhexidine mouthwash. So here these are some marketed preparations of the mouthwash. Let us see the throat paints. Throat paints are aqueous or alcoholic liquid preparation used for mucosal surface of throat. The main component of throat paint is glycerin. For example, betadine paint, crystal violet paint, clotrimazole mouth paint, and so on. So the mouth paint, these are the aqueous or alcoholic solutions prepared with a collodion base. For example, candid mouth paint. Let us see the glycerides. Glycerides are viscous, hygroscopic liquid or semi-solid preparation that contain not less than 50% by weight of glycerin and dissolved medicaments, that is known as the glyceride. The major component of glycerides, that is the glycerin. For example, borax glycerin IP, tannic acid glycerin. So here these are some marketed preparations of the glycerides. Moving towards the throat sprays. Throat sprays are the aqueous or alcoholic solutions intended to be applied to throat by means of atomizer or the nebulizer. For example, benzodiazepine hydrochloride spray. Marketed preparation like a diaphragm, sore throat spray, strepsils, soothing throat spray. Let us move towards the inhalations and ear drops. So inhalations are the liquid preparations containing volatile substances and are used to relieve congestion and inflammation of respiratory tract. That is known as the inhalation. For example, menthol and eucalyptus inhalation. Ear drop, these are the solutions of drug that is instilled into the ear with a dropper. These are used to prevent ear infection. For example, sodium bicarbonate ear drop, BPC. So here these are the some examples of the marketed ear drops. Let us see the nasal drops. Nasal drops are generally aqueous solutions of a drug that is instilled into the nose with the help of dropper. For example, xylometazoline nasal drop and otrivin nasal drop. Eye drops. Eye drops are the sterile aqueous solutions or a suspension of drug that instilled into the eye with a dropper. It should be buffered, isotonic, and free from foreign particles to avoid the irritation. For example, carboxymethyl cellulose eye drop. For example, moxifloxacin eye drops. Let us see the nasal sprays. Nasal sprays are the liquid preparations sprayed into the nose for local conditions like congestion and allergic rhinitis. For example, cromolyn sodium nasal spray. Here are some of the marketed preparation like nasal corn and equity nasal spray. Let us see the liniments. Liniments are the alcoholic or oleaginous solutions or emulsions of various medicinal substances intended for external application to the skin, generally with rubbing. That is known as the liniment. For example, turpentine liniment IP. Here these are the some of the marketed formulations of the liniment. Let us see the lotions. Lotions are the liquid preparations for external application without friction. Liniments with friction and lotions without friction. For example, calamine lotion IP. So here these are the marketed preparation, that is a lactocalamine and peclomethasone and salicylic acid lotion. Let us see the tinctures. Tinctures are the alcoholic preparation containing active principles of vegetable drug, that is known as the tinctures. Generally prepared by maceration and percolation or diluting liquid extract with the alcohol or hydroalcoholic solvent. For example, iodine tincture and benzoin tincture. Let us see the injections. Injections are sterile, pyrogen-free liquids, that is solutions, suspension or emulsions, or solid dosage forms containing one or more API packed in a single dose or multiple dose container, that is known as the injection. Let us see the advantages of the injections. Here, in the case of injections, we are getting immediate onset of action, then intramuscular and subcutaneous route used to achieve slow or a delayed onset of action. It avoids first pass metabolism. It is used in emergency and useful for drugs which are poorly absorbed from the oral route. Moving towards the disadvantages of injections, they are costly, then pain at injection site, then additional training is required, and aseptic processing of formulation is required in the case of injection. For example, paracetamol injection IP. So here, these are some of the examples of the injections. Moving towards the Dutch. Dutch, it is a medicated aqueous solution for rinsing body cavity, which is applied at a low pressure. For example, povidone iodine Dutch. Here, this is example of the Dutch. Enemas. Enemas are the liquids which are introduced into the rectum and colon via the anus. For example, flat enema and docusol enema. So here, this is the marketed preparations of the enema. Moving towards the biphasic liquid dosage forms. Very first one, that is suspension. So suspensions are biphasic liquid dosage forms of a drug in which finely divided solid particles are dispersed in a suitable liquid that is known as the suspension. Let us see the advantages of suspension. Suspension shows higher bioavailability than the solid dosage form. As solid dosage form, it is available in the solid form, and suspension, it is available in the liquid form. So we are getting greater bioavailability in the case of suspension. Suspension improves the chemical stability of the certain drugs. It can mask unpleasant and bitter taste of the drugs. It is easy to administer than the bulk solids like powders. Then the duration and onset of action can be controlled. So here these are the some of the advantages of the suspensions. Moving towards the disadvantages of suspensions, it is bulky, inconvenient to transport and storage. It is having a poor stability, then microbial contamination and the dose accuracy. For example, paracetamol suspension. Moving towards the emulsions. Emulsions are biphasic liquid dosage form of a drug in which one phase is dispersed into another phase and made homogeneous by the addition of emulsifying agent that is known as the emulsions. Let us see the advantages of emulsions. Emulsions used to administer unpalatable oils. Aqueous phase can be easily flavored in the case of emulsions. Oily sensation is easily removed. It improves rate of drug absorption and possible to include two incompatible ingredients. So these are the some advantages of the emulsions. Let us see the disadvantages. Emulsions are bulky, inconvenient to transport and storage. Storage condition may affect the stability of the emulsion. There may be the chances of microbial contamination of product and the dose accuracy. For example, liquid paraffin emulsion. So herewith we have finished the liquid dosage forms. We have discussed the monophasic liquid dosage forms and the biphasic liquid dosage form. Let us see the gaseous dosage forms. Gaseous dosage forms, that is the aerosols. So aerosols, these are the pressurized dosage forms containing one or more active ingredient dispersed in the propellant intended for oral or nasal administration as a fine solid particles or liquid mists. For example, salbutamol aerosol. So here these are some marketed preparation, that is salbutamol inhalation aerosol BP. Moving towards some devices which are used to deliver the aerosolized products, that is bitter dose inhalers and dry powder inhalers. Bitter dose inhalers, it is a device that delivers a specific amount of medication to the lungs in the form of short burst of aerosolized medicine that is usually self-administered by the patient via inhalation. And the dry powder inhalers, it is a device that delivers the medication to the lungs in the form of a dry powder. So this is a dry powder inhaler, and here it's a bitter dose inhaler. So here these are the references, that is the pharmaceutical dosage forms and drug delivery system by Ansel, Remington Pharmaceutical Sciences, and google.com. So herewith we have finished the brief introduction to dosage form. We have discussed the classification of dosage forms. We have discussed the introduction to solid dosage form, semi-solid dosage form, liquid dosage forms, and the gaseous dosage form. Thank you very much.